We'll go ahead and get started. My name is Elizabeth Paul, and I am Manager of Public Policy for the Birmingham Business Alliance. I want to thank everyone for joining us today on a Friday. I know it's a little different than our usual schedule, but wanted to accommodate Speaker McCutcheon's very busy schedule, and we're so thankful for him for joining us today and taking time out of what I know is a very busy session to be here with us. As a reminder, participants are muted. But love to see your faces. Hopefully we'll get back in person soon. But I will go ahead and turn it over to Mary Pat Lawrence of Protective to kick us off.
Well, great. Thanks, Elizabeth. I appreciate that. As you said, I'm Mary Pat Lawrence with Protective Life. Good to see everybody. I'm very excited to have our speaker, Speaker McCutcheon, here with us today. Just a few quick words about the speaker's background. I know that you're very busy, Speaker McCutcheon, and have limited time, so we're going to want to get to your comments very quickly. Speaker McCutcheon is from Madison County and lives in Monrovia. Although, Mr. Speaker, I think you moved recently, so you'll have to fact check me on that one.
No, we're still there. We're building a house, but we did move from one location on the property to another.
Okay, got it. I knew you had moved. I wasn't sure if it was nearby or what. So thanks for clarifying, but glad to know you're still in Monrovia. He was elected to the House in 2006 and became Speaker in 2016. He's been a farmer. He's also a retired law enforcement officer from the city of Huntsville. He and his wife, Debbie, are parents to 2 children and have 2 grandchildren. And Speaker McCutcheon, I know this has been such a challenging year, and I know that a lot of thought and work went into organizing the legislative session during a pandemic, and everything seems to have gone really smoothly, which is such a credit to your leadership. The legislature has already gotten so much accomplished in a short period of time, and it's really remarkable that it all came together and is functioning so well. So we really look forward to hearing your thoughts on the session so far and what's ahead, and just really appreciate you being here today. So with that introduction, I'll stop and turn it over to you.
Okay, well, thank you very much, Mary. And let me say thank you for inviting me to be a part of this Zoom meeting today. The session has gone well. At this point, the House and Senate has introduced 876 pieces of legislation. Of that 876, 541 have been introduced in the House. The beginning of the planning stage, if you will, for the session was contentious, trying to figure out how we were going to work through this, all of the issues that we had with public access, transparency, trying to work on pieces of legislation and do it in such a way that we could keep members safe. But I have to say, and I know we've got some legislators on the meeting today, I have to say, to their credit, everybody has worked well together in the House and Senate to follow the regulations that were put in place and the procedures that we are working under. Like I say, my biggest concerns were, one is the health and safety of the members and staff, and then the other was the access of the public. And so, due to the way the state house is made, the confined areas, the small rooms that we have for offices and committee meetings, we had to make some big changes. And so what we did is we set up meeting rooms on the first and second floor of the state house for people from the public that want to meet with representatives could set up a scheduled meeting, come down and meet with them in larger rooms to provide safety. We had to split up the House chamber membership and put some of them on the 6th floor in the gallery, and also some overflow rooms. We were able to put in some technology, which was some iPads that members were able to do voting with those iPads if they were seated on the 6th floor or in those overflow rooms. And of course, this was always a challenge for the House. If you'll remember, when we came in May of 2020 to finish up that session, it was a real challenge for us to try to vote, because in the House, we vote through electronic means, and that vote is recorded And of course, therefore, all of the paperwork and the journal and everything that's done, comes through that system. And so because of that, we had to figure out some way that we could vote. And so the iPads that we purchased have been very helpful, and they have worked very well. And members are working well together. And so far we're doing really, really well with the session. Everybody's healthy. We've had a few cases of some members that have gotten sick, but it was not COVID related. And we're very pleased with where we are. We came in for 2 weeks, and then we took a break to do an assessment of where we were with the Senate leadership. Things were going well, so we came back in, and we will be, as we start Tuesday, the 16th of March, we'll be on our 15th day. So we'll be halfway through with the session. Then we're going to work this next week for 2 days, session days, and then we're going to take a week off for spring break, and we're going to come back and we're going to do another assessment and see where we are. We've got more members that have been vaccinated. Some of the staff are being vaccinated now. We're going to just do an assessment of where we are, and hopefully we may be able to relax some of those procedures that we have when it comes to public access. Can't say for sure yet. We're just going to have to take it week by week. As you know, the governor extended the mask mandate or the mask restriction for through April 9th. And we may work under that schedule as far as public access and looking at how we're going to approach the end of the session. But overall, we had an agenda as we started. We were working very close with the governor and the Senate, and we were dealing with 3 key pieces of legislation that were priorities, plus the 2 budgets. And we have stayed on track with that schedule. We were able to pass the Jobs Act tax incentive issues for recruiting business to Alabama. We were able to deal with the tax credit for Alabama citizens that received CARES Act dollars that they wouldn't have to pay state tax. And we worked on the liability issue to protect businesses across our state. And those were 3 priorities, and we were able to work on those and get those out of the way. And then once we got to that point, then of course we began to focus on the budgets. And the House this week has passed out the general fund budget, one of the largest general fund budgets that we've had in the history of our general fund. And I am pleased to say that the House worked very hard on that, and members had input, and we were able to get that budget out of the House to send to the Senate. Now we're going to wait on the Senate to finish up their education budget and send that down. And we're hopeful that we will have that this next week before we go out on spring break. But we'll just have to wait and see. But to that point, the budgets are really priority, and we're trying to move them faster than we have in the past due to the fact that we would hate to get this far into the session, have a COVID outbreak within the staff or the members, and then have to shut the session down. And so we're really pressing hard to try to get those budgets out so we can move forward. We've dealt with a lot of good issues. We've dealt with agency bills. We have dealt with bills dealing with our economy, and we're continuing to work through those. We have some hot button topics, if you will. Any issues that we've got dealing with voting is always going to create a lot of debate, and we've got some of those bills that have been in committee that we're looking at, and we're going to work together on those and move those forward. We've got some bills dealing with the alcohol 3-tier system. This one of those is having home delivery for alcohol, and that bill is being worked on. We've got some issues dealing with the state government oversight. The House passed out a bill and sent to the Senate dealing with creating an oversight committee to look at the governor's expenditures of anything over $10 million of significant amounts of money, where we would have an oversight committee made up through the legislature to at least look at those expenditures and have some input into them. This was not a a slam at the governor, if you will. It was just a matter of, we felt like it was good policy and good government. One of the things that brought that to our attention was the fact that we were looking at close to a $3 billion expenditure on the corrections issue. And right now, the House and Senate is working very close with the governor on that. But this bill was not designed to stop or to hurt the governor in any way in her actions, but just it brought to our attention that if we're going to be spending large amounts of taxpayer dollars, then the legislature appropriates that money, and we feel like it's just good policy to assist the governor and have some input. Marijuana issue is in the House now. The Senate passed it out. It's gonna create some debate. What I did on that bill was I sent the bill to 2 committees, and I know there's been some publicity out there about the fact that was this some way to try to kill the bill, and in no way was it designed for that. The reason for it is because this is an important issue to the people of Alabama, and there were legal questions being asked by members in the House as well as the health portion of this bill. And because of that and the limited access of the public, I felt like that the 2 committees could answer questions, educate members, as well as educate the public so that the public would have more input into how we might approach that bill. Honestly, I think the bill had a public hearing in judiciary. It will go on to health. I think the bill will probably have an opportunity to go to the floor, and I look forward to a debate on that. The big 800-pound gorilla in the room, if you will, has been the lottery issue. And as you know, we had an issue with the lottery in the Senate. The House did not have a lottery bill, but the Senate was working on a lottery bill. And this past week, that bill failed in the Senate. So now the question is, what do we do? Where do we go from here? There's several bills out there. There's some bills in the House and the Senate dealing with just what people want to call just a plain lottery. But honestly, for several years, we've dealt with this issue. The polling numbers tell us that the people in the state are really leaning towards being supportive of a lottery. But when we start talking about the lottery, we have the Porch Creek Indians issue, which already has a presence of gaming in the state, of which the state gets no revenue. And then you've got these other facilities, one including is right there in your back door there in Jefferson County. You've got these other gaming facilities around the state, and there's questions about, are they going to be a part of this discussion? They want to be a part of the discussion, and they want to have input into it. And so you've got all of these different groups coming together that want to sit at the table and talk about this lottery issue and how they may be affected and or their influence. So that's where we are with that. There's no particular bill that leadership has stamped as going to be their bill moving forward. We were working very closely with the governor, with Senator Marsh's bill that failed. And from there, we're just going to have to keep up working the process and bringing members together so that we can talk. Rural health care, broadband, these were all important issues that were being looked at from the revenue sources that would come from the lottery bill. And we've got a bill that came from the Senate dealing with broadband, and we're working through that. And I'd like to think of broadband as being a broadband high-speed internet type bill. You know as well as I do in the business community that we need to expand our capability in the state. We've got a lot of areas to where they have people that are unserved, and we need to expand the capabilities all over our state. We saw this with the pandemic, with the education, with children being out there, and the need for broadband with them not being able to be present in class, and they were doing their classwork virtually. And so because of that, it's put a little bit of a priority on this issue. So we're going to continue to work on that. We're going to look at that Senate bill, and we're talking and discussing it now. There was also some issues when it comes to the management of state government with the pandemic and the declarations of emergency that the governor has worked on this past year. I want to say personally, I think the governor's done a good job. It's easy to point fingers and say, well, we should have done this or we should have done that. But keep in mind, this is something that we've never dealt with before. and it was very serious. And because of that, the governor did the best job that she could based upon the information she was getting from our medical professionals. And I've been fully supportive of what she's done. Now we're sitting back as a legislative body saying, what can we do? What should we have done? What could we do better? And these are legitimate questions. And so because of that, there's been some pieces of legislation dealing with things like, can the legislature call us into special session? Would there be input into the governor having the authority to do a declaration? These are all things that are very, very important, and they need to be talked about. I know I'm working very close with the Pro Tem Reed in the Senate to try to work towards putting a task force together of the House and Senate members in the legislature, where we could review all of these things that's been done and sit around the table and talk about what we did right, what we did wrong, and what could we have done better. And I think this is very wise, and I think it's a good way to approach this. And with that being said, this task force will encompass some of these individual pieces of legislation that are being worked on by members in the Senate and the House. So just keep that in mind. We're going to continue to work on that as we move forward. With that in mind, I could maybe I'd like to maybe give an opportunity to maybe answer some questions and speak directly to what some needs that some of the people on may have.
Thank you, Mr. Speaker. That's great. You've covered a lot of ground, so we really appreciate that. We have had a few questions come in, but what I'd like to do is just give the opportunity to anybody on the line who wants to ask a direct question. So anybody who's wanting to ask a question, feel free to speak up and ask now. Otherwise, I can turn to the questions that have come in over email.
Hello. Yes, I have a question. Thank you, Senator Hutchins, for speaking with us today and taking the time. This past Wednesday, my name is Selena Rogers Dickerson, and I'm the owner of Sarkor. I'm a civil engineering firm here in Birmingham. This past Wednesday, I was at a committee meeting for House and Ways committee meeting for education on behalf of HB 487 for charter school funding, and as a proponent of that. And one of the things that I spoke about is the importance of how the funding for schools should follow the students. For public schools, if it's a public school, the rules should be the same for the public school. And I grew up in West Birmingham. My parents worked very hard to put my brothers and I through private school until I was later accepted into Ramsey. But the reason why is because, this is before there was a quote unquote failing school, but I was in a overcrowded school with not the right resources. And now here, and my daughter, y'all might have saw on camera a moment ago, but she's in kindergarten now at Asbury Academy. And when we were faced with, what we were going to do at the time, we were in in the city limits, zone for a quote unquote failing school, but our tax dollars don't follow our child. And there are a lot of hardworking parents that pay their taxes that have their children in institutions like I3 Academy that are doing the work to try to make sure that their kids have an equitable education. And I would just like to say that I hope that once that comes before the House next week, that you and your colleagues find that in favor to help those students, because just like any business, the schools need to be able to have the means to operate, and those tax dollars should be able to follow those students if they're no longer going to be in their county or city school. And so if you could speak to that, I would greatly appreciate it.
Yes, and I appreciate you bringing that up. We've had some discussions this past week from some of our education leadership in the House, the Education Policy Committee members, as well as the Ways and Means Committee members. This charter school system and the private school system, if you go back and look at the very beginning of that, it has evolved to the point of that we've had good participation, we've had good results, And the private charter school system has made a presence in our communities to help our children. And many of those, when we first started these programs several years ago, it was really based upon scholarship type private funding. But we have evolved, if you will, to a point now to where they're becoming a mainstream education provider in our communities. And the thought process among the leaders that have worked on this for several years, that was on the ground level, if you will, when we started this debate, has seen the need that the dollars do need to follow the children. And we need to go back to a more local type evaluation, if you will, or number counting of students, if you will, to make sure that those dollars stay with the child and they flow into that particular district to where they will help the child. And so because of that, we're moving forward with that. This is a very important issue, and there's a lot of work being done. But I think we're at the point now where that we've seen it work. We've seen the importance of it, and now we got to make sure we get the funding right.
I appreciate that. Thank you.
Yes, ma'am.
Great. Anybody else have a question? We do have a few that have come in. So hearing none from the audience, Mr. Speaker, you did touch on this briefly regarding the corrections issue and potential oversight by the legislature, but one person has a question asking you to discuss the governor's plan for prisons and asking how we're going to pay for it and what happens if we don't address the problem. So if you could touch on that issue, that'd be great.
Okay. Of course, that could take us the rest of the afternoon.
Question, I realize.
I'll do the best I can.
Okay.
As you know, the legislature tried for a couple of times to create a state bond issue to build new facilities. And there's still a difference of opinion among legislative members as to whether we need buildings or whether whether we need to change the operation, administrative things that we do within the walls of the buildings that we have. But the bottom line is this: many of our facilities are very old and they're outdated, and it's more. We have moved in our correction system to more of a dorm type atmosphere, to where you may have as many as 200 plus inmates in a dorm setting. And if you have problems, or if you have sickness or whatever it may be, that you may need to segregate prisoners away from each other, there's certain facilities that we've got that just does not have the space to do that, nor are they equipped to do that. So because of that, I think there's a legitimate argument to say we need to build new facilities. All right, with that in mind, then comes the question as to how we're going to pay for them, and what kind of plan are we going to have to pay for them. The governor has put together, with reports from some study groups that have been done, that we need 3 facilities. These 3 facilities would be brand new facilities, and the governor feels like that in her plan that we need to build the facilities through outside private agencies and lease those facilities to the state corrections department. The legislature, some members of the legislature have a little different opinion of that. Number one, because of the cost factor. Number two, because of the size of the facilities and the number of inmates we have going into our systems now. Is it big enough? Will it accommodate what we need to accommodate, and the cost? And so because of that, there's been some discussions with the governor, and she's been very welcoming to sit down and talk with us about the fact of, could we do this on a state bond issue where we would actually own the facilities instead of leasing them? So right now, the governor has moved forward with her plan, and she's got 2 facilities that are under contract now. She's still working with the private investors to get the bond issue set up. She's supposed to report back to us on the cost and the capacity and where we're going to be with that. And honestly, as we were working through this, the question came up is that, you know, is this going to be the answer? And of course, it's not the answer. There's several things that will be the answer. This is just one part of the answer. Do we need them? Yes, we do. I think there's no doubt we need them. Should the state own them? That's a question that we have. Are they going to be big enough? That's another question that we have. And then on top of this, we had the filing of the Department of Justice file suit on us. Keep in mind, up to just a matter of months ago, we were still in negotiations and there had been no official litigation filed. But now we're under a suit and the Attorney General is taking the case to the court and we're trying to defend our actions. And honestly, if it had not been for the pandemic and the situation that we were operating under during the 2020 legislative year, we would have been a lot further along than we are. And I'm hoping that the
He's muted himself.
You,
are we still there?
Yeah, you're there now.
Yes.
Am I back?
You're back.
Okay, I'm sorry.
You're fine.
I hope I touched on the question.
Oh, good. Okay, perfect. Yes, you did. Thank you. Thank you so much. And then one more you did mention just related to the budgets. And, you know, the budgets have been robust in the past couple of years and including this year. And the question is if you could just touch on that, elaborate on that a little bit further and talk about what the outlook is for the future.
And I'm glad that we have that question because I don't know if, you know, budgets are issues that people are concerned about if they are looking for a certain line item in the budget to support a certain agency or group that they're concerned about. But at the end of the day, we should be very thankful in Alabama for us being in the position that we are to take care of our state's needs. There's many states that during this pandemic, this past year, that are really struggling. They're actually trying to borrow money just to make sure that they have enough money to operate the state agencies. We have seen a growth. We had a growth when we passed our budgets in May of 2020. We are looking at the numbers and have a growth now as we're preparing these budgets for the 2022 year. And it's something that we should be very thankful for. I think our growth is because of several reasons. I think one of those reasons is that we have actually saved some money. If you'll remember a few years ago in the something keeps interfering. Am I still with you?
You are.
Okay. All right. We had a budget that we had $25 million in the general fund budget. And actually what we did, we could have spent that money. There was needs out there that we could have spent it on, but instead we made the decision to save it and carry it over. And that has produced a huge savings for us in that general fund because most of you don't remember, but the next budget year we had an actual decrease in the Medicaid ask. Well, then that helped us add to that 25 million, which carried us in to the next year. On the education budget, we put in place several years ago the Rolling Reserve Act, which what we done is we used an average of several years to figure out what our growth would be for the upcoming budget that we were debating in the legislature. And so because of having that lower percentage rate, we were not on the up and down roller coaster. We had more of a level increase to manage from, and it was just good fiscal responsibility. And so because of that, we were able to save money in the education budget. As a matter of fact, when we closed out the budget during the pandemic, what we did, we were actually able to use some savings that we had of about $300 million to move us forward into the rest of that budget year, so that when we came back this year, we would be on even numbers. Well, lo and behold, we actually end up showing a growth in our education budget as we moved forward. So now we're dealing with a budget in education that has a growth to it. And the general fund is showing a growth as well. So this just didn't happen. We've managed well, and we have made some smart decisions to get us to the point that we are, where that we're in a growth pattern now.
Thank you. That's great. And Alabama really does have a great story to tell. I mean, I know so many states across the country are facing budget shortfalls and deficits. So it's really phenomenal that Alabama's in the position that it is. So kudos to all of you. And then we did have a question about the schedule, which you also referenced. And just curious if you think the session will end early because of COVID, or if you anticipate going the entire time, or how do you think that's going to play out?
Well, of course, it's hard to say as of today, but I'm very optimistic in the way things are going. I think that we'll be able to put in the full 30 legislative days. I believe the end session time is going to be on the calendar would be May the 17th. And the track we're on right now, we should be able to finish all 30 legislative days in the session. Now, would it be short? If we can get all of our business done and we can finish on a good note, there's always a chance that we could eliminate a day or two on the end. But right now, the expectation is to take this spring break, come back, get those budgets out, and then from there, we're just going to look at the legislation that we have left to work on, the importance and the priority of those pieces of legislation, and move forward. And if we need to, we'll be there for the full 30 days.
Got it. Thank you. Good.
Speaker, I've got a question. What is the speculation on a potential special session? And what's the latest that you're hearing on the redistricting?
Good question. Good question, and a very important issue. We're certain that we're going to have a special session. Right now, the special session would be to take care of the redistricting for the reapportionment committee. That date keeps moving around. We were first looking at possibly September as being the date that we were going to get our numbers back. Now we're looking at the possibility of October getting those numbers before we can finalize everything. But there's no doubt that we will be in a special session to work on the reapportionment and the redistricting issue, no doubt. And I feel certain it's going to be towards the fall, maybe hopefully early fall, but right now it looks like it may be all the way into October before we're finished.
Great, thank you. We did have one question, not necessarily for a position, but more just for an update on the bill that will impact transgendered youth. I'm not sure if you have an update on that one, Mr. Speaker.
Well, there's a lot of discussion about it. And of course, this is not the first time that we have looked at that bill in the legislature. It's been on the agenda. We had it on the agenda last year, and there's been some discussion on it for a couple of years. But there's a bill that's come out of the Senate that's in the House now. The House sponsor is working with the committee on the Senate bill as well as the House bill. We feel like that bill will probably be in a position to where it may make it to the floor and be debated on the floor. There's a lot of a difference of opinion on this, parents' rights. There's a lot of members that want to know more about the medical profession and what type of safety nets are put in place for the medical profession to check these children, from the psychologists to the medical doctors to the medications that are given. So this is one of those pieces of legislation that's it's really creating a lot of hallway discussion, if you will, about the issue, because you're dealing with an issue to where that if the medical profession is doing what they're supposed to be doing, and this becomes an issue of parent and child, then we still live in America. And there are still First Amendment rights, and there's still issues out there for parents to be able to take care of their children as they see fit. And do we want government stepping in, telling parents what they can and cannot do, regardless of how you may feel about the issue?
Mhm.
And so because of this, there is a lot of discussion. And me personally, I'm talking, in this next week, I'm going to be talking to a lot of the medical professionals, trying to get some opinions from them just on the personal voting issue for myself.
Mhm.
So I think that's where a lot of members are.
Great. Thank you for that answer. I appreciate that. Well, and I know you've spent a lot of time with us, so and unless there's any questions out there, we just want to thank you so much. I know it's a really busy time. We really appreciate you being here with us today, Mr. Speaker, and thanks for all your leadership and your service. And best of luck to you with the rest of the session, and I hope we'll be seeing you very soon.
It's always good to see you, and thank you for your leadership and very important region of our state. And make sure you tell your representatives and your senators thank you, because they're working very hard, and they've been working under some difficult situations, and I'm very proud of the work that they're turning out. So y'all just take care and stay safe.
Thank you so much, Mr. Speaker. Have a nice weekend.
Okay, you too.
Okay. Bye-bye. So with that, guys, we wanted to go ahead and let Speaker McCutcheon go first. He had some time constraints, but we do have a little bit of other business or one agenda item on the schedule that we want to turn to, and that's the prescription benefits or the Pharmacy Benefits Managers Bill, PBM. And I know that that is a bill that BBA opposes. Protective Life is also in that category of opposing. But I did want to turn it over to Ted Haas to give us just an update on the bill. So Ted, I see you out there. I'm going to turn it over to you if that's okay.
Yep, thanks, Mayor Pat. Appreciate it. So Senate Bill 227 was introduced by Senator Butler. In the Senate, that was introduced by Leader Ledbetter in the House. In the Senate, it went to the Banking and Insurance Committee. As Mary Pat said, it purports to regulate pharmacy benefit managers. Anybody who has a health plan with prescription drug coverage, which I assume is everybody on this call, whether you know it or not, your prescription drug benefits are administered by a pharmacy benefit manager. It's a really complicated piece of legislation, but based on our analysis of it, we think it will add significant cost to your health plan's prescription drug costs, prescription drug benefit plan. And it does this by a couple ways of limiting the PBM's ability to save costs. There are two that I really kind of want to highlight. One is it prohibits a plan from creating options that an employee can choose that would be less costly to the plan. And the best example of that I can think of is a mail order option for things like maintenance drugs, cholesterol, blood pressure, that sort of thing. Typically, when you have a mail order program for a maintenance drug like that, what happens is you get 3 months supply of that drug for only 2 copays, whereas if you choose to go to the store instead, you're going to pay 3 copays for the 90 days worth. And the goal of that is because mail order is so much cheaper, you want to encourage your employees. It's not just cheaper for the employee, it's cheaper for the plan. So it would eliminate lots of different lower cost options that could be incentivized by an employer that save millions of dollars for plans. I'll give you an example. The University of South Alabama, which has 5,000 members, it's a big plan, 5,000 members in its plan, estimates that its use of optional mail order programs saves them about $2.2 million per year, which is obviously a significant amount of money. I can't do the math that well, but I'm thinking that's about $400 to $500 per contract in their plan per year. Someone correct me on the math there, but Another piece that's in here that is, we think is going to be taken out in a substitute, but it is in the current bill that was introduced, and that would require pass-through rebates of at least 80% to the customer. That takes all of that revenue out of the plan. The plan uses it usually to lower premiums for everybody across the board. So that money would have to be replaced. The cumulative cost of this bill, that for the plans that have looked at it, they're about $800 to $1,100 per contract, which is basically per employee. So that's a very significant increase in cost. There's lots of other things that this bill would do. I don't want to get into it and take up too much of your time, but we think this bill would be terrible for your health plans. And we're obviously working hard to oppose it. We would encourage you strongly to reach out to members, particularly members of the Senate Banking and Insurance Committee, who are deliberating on this bill. Like I said, there was a public hearing on this bill last Wednesday. The next time it comes up in that committee, it will be up for a vote. You have a couple Birmingham area members on that committee, Senator Wagner and Senator Roberts. If you're going to focus on one, Senator Roberts is having a little more deliberation on this issue towards the proponents of the bill than Senator Wagner is. We feel pretty good about where Senator Wagner is. I'm adding to the chat box a story that was posted in Yellowhammer News yesterday that goes through the details of the public hearing. I'm here to answer any questions if you want. I know there are some others on the call who have taken a look at this and may want to offer their opinion. I don't want to call on anyone directly just in case they've decided not to, though. So I'll turn that over for input from folks if it's desired.
Yes, hi, this is Anna Velasco. Can you hear me?
Yes.
Okay, great. Well, I'm Executive Director of Regulatory Affairs for Viva Health. Viva Health is a health insurance plan insurer, and we also administer the UAB health plans for UAB. And as Ted said, the bill is currently written would be extremely expensive to employers and to employees. Just sort of back of the envelope modeling, UAB predicts that the bill would cost somewhere north of $17 million a year. That's lost savings in their prescription drug plan that they're seeing today. So as all of you know, prescription drug costs are a huge problem, but we do not believe that attacking the pharmacy benefit managers is really going to do anything to help that. In fact, pharmacy benefit managers, although they are sort of portrayed as the big bad wolf, they are one of the few tools in the arsenal that employers have to keep their prescription drug costs down. And a lot of employers have found them extremely helpful in doing so. So we encourage everyone to talk to your, those who are looking at your health plans and ask them, how much money their PBMs are saving them a year. And then look at the bill and see the limits that the bill would put on place in the PBM's ability to find those savings for the employers and the employees.
Great, thanks, Anna. That's super helpful. I would just agree, we've had conversations with our HR department this week and have found the exact same, that this is going to increase costs significantly for our over 3,000 employees. So obviously a very bad bill for a lot of us on the phone. And if you haven't talked to your HR department, so I encourage you to do so, because a lot of times HR really isn't brought into the government affairs space like they should be. And this is one that's worthy of reaching out to them for. So any other questions on this? Ted, thanks so much for that information. I think I heard somebody else on the line.
Yeah, Mary Pat, this is Suzanne Respis. I was going to ask Anna and Ted, does this impact the Medicare PBMs as well?
No, not,
No.
no, but, Ted and I have talked about this a little bit. we think it'll be very confusing to the pharmacies. You know, anytime you have in the industry one segment doing something one way, where, for instance, mail order is discouraged, then that will affect practices, you know, whether it directly affects Medicare or not. But no, it will not affect our Medicare PBMs.
There's a question in the chat box from Representative Wheeler. Good to see you, Representative Wheeler. And the question was, what is the increased cost to PHIP? The estimated cost to PHIP is about 84 million, as currently drafted, about $84 million annually. But because of the way that the budgets line up in the first year, the additional cost from this legislation that's been estimated by PHIP would be $159.7 million that would either have to come out of the Education Trust Fund budget or would have to be imposed upon the employees in that system, or some combination of both. The increase on a per member basis would be therefore $1,283 per member, so per contract in that system. So it's a significant cost to the Education Trust Fund and or to the teachers or employees in the system.
Thank you.
Sorry, Ted, I was saying thank you for asking that question, because I certainly would have messed up that acronym, so.
And I've also received a helpful text from a friend on this call, and I had left out Senator Smitherman on the list of members of the committee who are Birmingham, Jefferson County area folks. So Senator Smitherman is also on that.
Great. Okay, well, thanks for that helpful update. Elizabeth, I guess I'll turn it back over to you. Maybe to let us know when the next meeting is going to be. Anything else we need to know?
Absolutely. Thank you so much, Mary Pat. We appreciate you leading us this year through the pandemic. So our next meeting is going to be Monday, April 19th. Thanks everybody for bearing with us on this schedule change. For today's meeting on the 19th, we're going to be hearing from Senate President Pro Tem Greg Reed, and he will keep us updated on what's going on with the session at that point. On behalf of the Birmingham Business Alliance, thank you everyone for joining us today. And this concludes our meeting. Look forward to seeing y'all in April.
Thanks, everybody.